You brush, you rinse, and you visit the dentist once in a while. But what if I told you that your mouth could reveal the future of your entire body's health? Heart disease, diabetes, even some cancers, they all have one surprising thing in common: your oral health. According to the World Health Organization, oral diseases and major non-communicable diseases share the same risk factors, yet this connection is often ignored. This isn't just about teeth, it's about your life expectancy. Your mouth is more than a smile, it's a gateway to your bloodstream. Every time you eat, brush, or even swallow, billions of bacteria pass through it. When oral hygiene breaks down, those bacteria can trigger inflammation that spreads far beyond the mouth. Studies published in the Lancet Global Health show that poor oral health is linked to cardiovascular problems, uncontrolled diabetes, and even dementia. Yet, globally, oral health remains one of the most neglected aspects of healthcare. Let's look at the numbers. Nearly 3.5 billion people suffer from oral diseases. That's almost half of humanity. Cavities, gum disease, and tooth loss aren't just cosmetic issues, they are biological stress signals. The WHO warns that untreated oral diseases cost the global economy hundreds of billions each year, not only through dental treatment but through their hidden links to chronic illnesses. So the question is, how did something so preventable become such a widespread global problem? Here's where the connection gets clear. Oral diseases share the same risk factors as heart disease, diabetes, and cancer, things like high sugar intake, tobacco use, excessive alcohol consumption, poor nutrition, and low physical activity. When you think about it, your mouth is the first place these risk factors show up. A diet high in sugar doesn't just rot your teeth, it spikes your blood sugar and feeds chronic inflammation. Smoking doesn't just stain your gums, it narrows your blood vessels and increases cancer risk. It's all connected. Researchers have discovered that periodontal gum disease triggers inflammation that can affect the entire body. Bacteria from infected gums can enter the bloodstream and stick to the walls of arteries, accelerating plaque buildup, a key driver of heart disease. In people with diabetes, high blood sugar weakens gum tissue, making infections worse, and gum inflammation, in turn, makes it harder to control blood sugar. It's a vicious cycle. This bidirectional relationship is so strong that dentists can sometimes spot early signs of diabetes before doctors do. Your mouth is literally your body's early warning system. The World Health Organization is now calling for a complete shift in how we think about oral health. Instead of treating cavities and gum infections after they occur, who urges countries to integrate oral care into national strategies for non-communicable diseases NCDs like heart disease and diabetes. That means making prevention and health promotion the center of care, not expensive dental treatment. Imagine a world where a visit to the dentist could also check your heart, your glucose, and your nutrition risk, all in one appointment. That's the future who envisions. Most people only go to the dentist when it's already painful, but prevention is far cheaper and more effective. Through reports that simple actions like brushing twice daily with fluoride toothpaste, reducing sugary foods and drinks, avoiding tobacco and alcohol, and regular checkups can prevent nearly 80% of oral diseases. And that doesn't just protect your smile, it protects your heart, brain, and entire immune system. In many developing countries, oral health is still viewed as a luxury, not a necessity. Millions live with chronic oral pain that affects nutrition, speech, self-esteem, and work productivity. But the real cost is invisible. Untreated gum infections may silently fuel other diseases for years. The longer we separate oral health from overall health, the more lives we risk losing unnecessarily. Here's how you can start protecting your whole body health today. Brush and floss daily, not just for your teeth, but for your heart. Eat more fiber-rich, less processed foods. Avoid smoking, it's the biggest preventable oral cancer cause. Stay hydrated, saliva is your natural defense. And most importantly, see oral health as part of your medical health, not separate from it. Your mouth and your body are one system, take care of both. Your mouth tells your story, what you eat, how you live, and even what diseases may come. It's time to listen. The World Health Organization's message is clear. Integrating oral health into every nation's health system isn't optional, it's essential. Because the key to preventing diabetes, heart disease, and cancer may begin with something as simple as a toothbrush. Your health starts here, in your mouth.